Hello everybody, Dr. Brad here. I'm a Burlington, Ontario chiropractor at Life Chiropractic Center on Guelph Line. I'm also a certified posture expert and certified posture neurologist with the American Posture Institute. And today I'd like to share with you a case history. One of my longest tenured patients, she has been with me almost my entire career, asked me if I could check out her 4-month-old grandson. Now, this poor little guy had a very traumatic birth. First of all, it was a C-section delivery, and secondly, they needed to use the head vacuum to extract him from the womb. And immediately after birth, he had a torticollis, which means that his head was turned to the right and stuck that way. He couldn't move his head or his neck. And he had this huge, noticeably and unsightly lump on the top of his head where they attached the head vacuum. Now, the family doctor reassured them that these issues would resolve on their own, and 4 months later, nothing had changed. And not only had nothing changed, but he could not hold up his head. When you held him up or sat him up, his head would either flop frontwards or backwards, and by 3 to 4 months of age, every little baby should be able to hold their head up under their own power. And this is when my patient in desperation reached out and asked me if I could help. And I said, sure, I would take a look and I would do the very best I could. Now, after assessing this little guy, this required a team approach. I addressed the neck injuries and the misalignments in his neck that were a result of the birth trauma. And my partner, Dr. Lin, who is proficient in cranial technique, started to work with his skull bones to reshape his skull and reduce that unsightly lump. Now, he has had 4 adjustments so far. His 4th adjustment was yesterday, once a week for 4 weeks, and the improvement has been remarkable. The torticollis is 50% better at least. He can hold his head up under his own power now. He doesn't flip and flop frontwards or backwards. And the lump on the top of his head has been significantly reduced. Now, the reason I am sharing this specific case history with you today is, despite what you may have seen or heard or read in the media recently about chiropractic and about chiropractic treatment of kids, I want to reassure you that we have been helping kids of all ages, including little babies just like this, safely and effectively for over 33 years. And most of my chiropractic colleagues would tell you the very same thing. Thanks for watching, everybody. See you again next time.